nationally, we're incredibly dependent on data from the CDC. It's the greatest resource that we have for national data. So, for example, there's some delay, but you produce the number of deaths per month in the United States. Will those data continue to flow from the CDC? They're critical for people to have access to.
Absolutely. I mean, it's the blood of CDC.
Yeah.
But if it's even more than that, Howard, one of the first things that I recognized when I became CDC director was that for a variety of reasons, our nation has failed to invest appropriately over the last 20, 30, 40, 50 years in what I call the core capabilities of public health. I had a presentation that was made to me. Very priority, obviously, was opioid-related deaths. I almost lost one of my 6 children from contaminated cocaine with fentanyl. It's a priority for the president, priority for the secretary, and I got briefed on it. And when the briefing was finished, I asked what the data was through, and they told me March 2015, and I said, but it's April 2018.
Yeah.
And I was told that I didn't understand all the complexities of getting all the data. And then I remembered, like you, reading the MMWR, and frequently the MMWR was telling me what happened a year ago or two. Getting data so it's real time and actionable has been a big thing. I can tell you now we get data within 48 hours on opioid deaths across this country. And we're on a big push. Congress has started to realize the need to do what we call data modernization. Originally gave me $50 million, recently another $500 million to begin to modernize, not just CDC's data, but we need to modernize the public health data system for the whole country, states, local health departments, territory, tribes. So we are deeply committed. We are expanding and modernizing, so our data should not just be real time. I want data to get to the point that it's predictive data analysis. And so we're actually predicting, using data to predict, and I'm confident you're going to see the data modernization that's currently being driven into CDC. It's going to obviously happen past my watch, but that's going to have tentacles into the public health data system across this nation. So it's definitely the lifeblood of CDC is data, and that lifeblood is meant to be available to the American public to have that data, and I can guarantee you that will continue, and it's going to, I think, be an exciting time as there's greater investment in the core capabilities of public health, particularly data modernization. When you think of where we are right now, with the ability like we did with opioid overdoses and drug overdose deaths, what we did was we brought syndromic surveillance into it, so that all of a sudden every medical record was a public health tool. All of a sudden we had thousands and thousands of new public health workers, nurses, doctors, PAs, nurse practitioners, social workers. Anything that was in that medical record now could be a public health tool if we just take that electronic medical record and be able to use that. So bringing electronic medical records, direct reporting from laboratories, putting all that into an integrated public health data system, I think is going to revolutionize the ability of data to be actionable. When we had the Avali syndrome, the ability to use that syndromic data system to go back and look and say, wait a minute, where are we seeing this severe pulmonary illness? And all of a sudden, we didn't have to wait 30 days, 60 days, 90 days, 120 days, 6 months for reports. We could go right into the electronic medical records and pull out. So critical. I think it's just going to get stronger and stronger. And it is one of the critical roles that CDC does play as a group that can really pull that data and do the analytics that need to be, so there is a public health response to that data that can improve the human condition in this nation.